Hey guys, so we're reviewing endocrinology reproduction here. There are 8 diseases that you need to know. The first one is diabetes mellitus, which is diagnosed as increased fasting glucose above normal 100 milligrams per deciliter, namely 126 or more for diabetes. Everything in between is prediabetes. Elevation between 100 so above 100 and less than 126. So there are three types of three types of diabetes that you want to know: type 1, type 2, and gestational diabetes. Type 1 is due to absence of beta cells, abbreviated as T1DM. Type 2 is abbreviated T2DM and is due to insulin resistance. Gestational diabetes mellitus, abbreviated GDM, is due to increased insulin resistance in pregnant mothers. Basically, what the problem with gestational diabetes mellitus is that they have large for gestational age babies that are more than almost 9 pounds. I mean, these are huge babies, but problems don't stop there. There are often fetal defects, and these babies are born earlier than normal. They're premature. And what is very interesting is that the babies, after they're born, actually get hypoglycemia because babies are not insulin resistant. It's the mother that's insulin resistant. Gestational diabetes mellitus patients usually are no longer insulin resistant after delivery. All right, let's talk about type 1 diabetes mellitus and its special case of diabetic ketoacidosis. Type 1 diabetes mellitus is obviously due to destruction of pancreatic beta cells, and it usually happens in childhood. There is absolutely no insulin production. There is no cure for this problem. As of now, patients do require insulin and are going to die if they do not take insulin. They absolutely need insulin for survival. So the problem with type 1 diabetes mellitus is a particular metabolic state called ketoacidosis, which is rare in type 2 diabetes because patients with type 2 diabetes actually do have some rudimentary insulin production, no matter even down the road where their insulin production by beta cells is actually drastically decreased. So diabetic ketoacidosis presents with fruity breath odor, nausea, vomiting, and abdominal pain for which we don't know the reason, but they obviously also have increased urination, polyuria, because they do have elevation of glucose. Glucose sucks water with it and actually causes all these problems, just like in all types of diabetes mellitus, peripheral neuropathy, visual abnormalities. They're all common to type 1, type 2, and gestational diabetes mellitus. Patients with either diabetes mellitus or diabetes insipidus, they all have increased urination, polyuria, and therefore, because they lose so much water, thirst is a given, polydipsia is a result. But in diabetic ketoacidosis, there is an increase of ketone bodies, which are acidic. Ketone bodies are acidic, and this results in decrease of body's baking soda, i.e. body's bicarbonate, which is body's own antacids. Okay, so elevation of acid, antacid made by the body is the bicarbonate, and it's obviously increased. Now let's talk about Cushing's syndrome. Actually, Cushing's syndrome and Cushing's disease can cause diabetes mellitus. If a patient gets Cushing's disease due to medications, that's called a medication-induced diabetes mellitus because glucose is elevated. Once you take care of the cause of Cushing's disease, diabetes mellitus is automatically going to go away. So the problem here is either with Cushing's syndrome is increased adrenal gland cortisol production. With Cushing's disease, it's the pituitary gland problem. Moon fasces is extra fat on the sides of the face, which makes the face look puffy. and round or swollen, but other problems include hirsutism and stretch marks, which on skin, which we call striae, similar to post-pregnancy stretch marks. Osteoporosis is given. Remember that Cushing's is not Conn's syndrome. Cushing's happens due to overproduction of cortisol. Cushing's Conn's syndrome is due to adrenal gland overproduction of aldosterone. So this is not the same hormone, right? So there is a thing called Cushing's triad, three things triad. 1, hypertension. 2, bradycardia. 3, irregular respiration, which I'll go over in neurology, and this is not the same thing as Cushing's disease. Now let's talk about ADH. You can have an elevation of ADH or decreased ADH. As I explained in the lecture, hormone is a way cells talk among each other. Hormones are basically the voice, the words, the language. And so if there is diabetes, ADH is a anti-diuretic. Diuretic, as we already went over in a renal chapter, is something that makes you pee more. So anti-diuretic hormone means a no pee hormone. No pee hormone elevation, increase of no pee hormone is like someone yelling, don't pee all the time. Anti-diuretic hormone, when inappropriately high, will cause this thing called syndrome of inappropriately high ADH secretion. And obviously patient is going to not pee, not urinate, decreased urination, but all that water that's going to be saved is going to decrease the concentration of sodium. It's like a lot of water and the same amount of salt in the body. And so patients with decreased sodium will be having an altered mental status that you can actually notice. This is most commonly caused by medications, but can be caused by brain injury and a type of the lung cancer called small cell lung cancer, which is extremely deadly and deadly within 1 year. Now, when there is a decrease of ADH, it's like saying someone very quietly saying no pee, right? And so frequent urination is a problem, but note that the glucose levels are normal. And note that cortisol levels are normal. If cortisol levels are increased, we're going to suspect Cushing's, right? So this is due to diabetes insipidus and not diabetes mellitus. Mellitus, you would have sweet urine. Insipidus, you would have normal tasting urine. Patients with either diabetes mellitus or diabetes insipidus are both going to pee a lot and therefore going to be thirsty, polyuria, polydipsia. All right, now let's talk about a little bit about reproduction. We're going to have, you need to know delayed puberty in females implies lack of secondary sexual characteristics in a patient who is more than 12 years of age. Amenorrhea is defined as no menarche, first menstruation. So when there is no amenorrhea by 13 with no sexual characteristics, is still amenorrhea. When there is no amenorrhea, no menarche, first menstruation by 15, even if there is a normal in patient, if you see normal secondary sexual characteristics, if a girl looks like she's becoming a woman, that's still, you look for menarche, no first menstrual bleeding, that's it. She's got amenorrhea, that's the diagnosis. The flip side of it is abnormal uterine bleeding, that's the new term. And back in the day, there was a term called menorrhagia, monthly menorrhagia, extremely heavy blood flow that presented with extremely heavy bleeding for more than 1 week, more than 7 days. That was just a heavy menstrual bleeding called menorrhagia. We now call it abnormal uterine bleeding. No PCOS. PCOS is the most common endocrine disorder in women of reproductive age. We don't really know anything about it. We know a lot about it, but not enough. We know that there is too much insulin and too many androgens swimming around in serum. Too much of androgens, too much of insulin result in no ovulation. No ovulation means anovulation. That's the number one reason why females present to fertility clinics because they can't ovulate, and because they can't ovulate, there is no fertility. This is anovulatory and ovulatory, no ovulation, no ovulation, no fertility. Finally, let's talk about endometritis and endometriosis. Obviously, we're talking about the inside lining of the uterus, metron. One is an inflammation, the other one is a chronic condition. Endometritis is the inflammation of the endometrium that is most commonly due to childbirth, but maybe due to sexually transmitted infections. Chlamydia is the most common one, obviously, among bacteria. The signs and symptoms are what? Uterine tenderness, pain, symptom, bleeding, discharge, and fever may be due to bacteria causing entering the blood, etc. So endometriosis is something else. Endometriosis is a growth of this endometrial tissue outside of the uterus. So endometrial tissue lining, let's say it's growing in the ovaries, it's going to damage the ovary and therefore may potentially cause infertility. If it's growing in the uterine tubes, egg cannot really reach the uterus and no implantation can take place. The final point that you need to know is the difference between hyperthyroidism and hypothyroidism. You need to know very little. Hyper means too much of the thyroid hormone. Hypo means too little of the thyroid hormone. The main cause of hyperthyroidism is Graves' disease, an autoimmune disease that is going to present with eyes ophthalmos, exophthalmos, eyes protruding forward, anterior means in the direction of anterior, forward, bulging eyes out of the orbit, eyes that are bulging out of the orbit. Hypothyroidism obviously means decreased thyroid hormones. There may be elevation of weight in patients with hypothyroidism if they don't decrease their food intake because their basal metabolic rate is decreased.